Do I need a TB skin test? Tuberculosis TB skin testing is recommended only for people who have symptoms of TB or are at higher risk for becoming infected with TB germs, or are at higher risk of becoming sick if they have a TB infection. Should I be tested? You may need the TB skin test if you have any signs of TB: cough, tiredness, night sweats, fever, weight loss, coughing up blood. You may need the TB skin test if you have close contact with someone who has TB disease. You may need the TB skin test if you are a healthcare worker. You may need the TB skin test if you live or work in a prison, jail, mental institution, or a nursing home. You may need the TB skin test if you have lived or traveled in a country where a lot of people have TB. You may need the TB skin test if you use needles to inject drugs. You may need the TB skin test if you have certain medical conditions such as cancer, severe kidney disease, diabetes, silicosis, HIV infection, are on steroid medication, or are severely underweight. A healthcare worker will ask you questions to find out if you should be tested for TB. Please tell the healthcare worker if you have had a positive reaction to the TB test in the past, or have been on medication for TB disease or to prevent TB disease. What if my employer or school requires a TB test? If the healthcare worker determines that you do not need to be tested, you will be given a letter for your employer, school, or whoever sent you for the test. The letter will state that you have had a negative TB screening assessment and a skin test was not needed. Not everyone needs a TB skin test. If you have questions, contact your public health department or your doctor.